share with you for a few minutes tonight is a little bit of my story with breast cancer as a survivor, and then a little bit about why I've gotten involved in some of the volunteer work I've had, and maybe I can persuade some of you to join me. It really is wonderful to see so many people here tonight dedicated to fighting breast cancer. My personal journey began over 6 years ago when I was diagnosed with breast cancer. I started out with a lumpectomy. I had a sentinel lymph node biopsy, and I had several lymph nodes removed. And at that time, because there was cancer in my lymph node, I needed to have chemotherapy. So I had 8 cycles of chemotherapy. It took 6 months. And I knew when I started that chemotherapy that I would probably need more breast surgery later, because when I had the lumpectomy, they had discovered more than one tumor in my breast. So when I completed my chemotherapy, I had a second lumpectomy. That was in October of 2003. And that was to remove the residual cancer. But that surgery led them to discover that I had still more cancer in my breast. So instead of moving on to radiation therapy, I had bilateral mastectomies in November 2003, after which Kathy came to talk to me about what that was, what I could expect my life to be like after having mastectomy. Since then, I've been on hormone therapy. So I have learned what it takes to fight cancer in my personal life, but to affect the larger community and to make an impact that reaches beyond the personal, we need to raise our voices for public policies and legislation that will promote health, for access to quality health care, and for adequate funding for cancer control programs and for cancer research. So I am an active volunteer with the American Cancer Society, and especially with its advocacy affiliate, the American Cancer Society Cancer Action Network, known as ACS-CAN. This is a very real, very necessary, and very rewarding way to fight back. As a volunteer, I've had an opportunity to meet with our legislators here in Wisconsin and in Washington, D.C. to show them the face of cancer and to help them understand why the public policy priorities of ACS are so vital. And working with many other volunteers, we've been able to secure their support on a number of our issues. But maybe you don't want to travel to Madison or Washington. ACS-CAN is still for you. The easiest way to get involved is to simply join ACS-CAN. ACS-CAN will contact you when our legislators need to hear from us on a priority issue. You'll be given all the information you need to email or phone your legislator, and you simply give them your name, your address so they know your constituents, the message, and say thank you. Research has shown that it often takes only 3 personal phone calls from constituents to influence a legislator. I don't know if Senator Coles would tell us that's true or not, but that's what the research has shown, only 3. So that's a very simple and yet effective way to fight back. You may have noticed at your tables there are mirror centerpieces and there are some greeting card petitions. Did you know that right now there's a federally funded program, the breast cancer screening program out there to help women who don't have health insurance? This amazing program helps uninsured and underinsured women get the mammogram and the treatment services that they need. But there's just one problem. Currently, there's only enough funding to serve less than 1 out of every 5 women who are eligible for the program. I'm wearing a pink lady pin, which most of you can't see, that illustrates this issue. And if you're interested in getting one of these, it's very simple. You can join ACS-CAN tonight, and for $20 membership, and I will be happy to give you one of these cool gifts. Now I'd like you to take a look at the name tags that you got when you came in. And if your name tag has a plain mirror on it, I'd like you to stand up. So if your name tag has a plain mirror, please stand up. Most of you should have a plain mirror. Some of you have a lady in your mirror, and the rest of you have a plain mirror. All right. Now I want you to imagine all of us in illustrates the number who will not be served by the Breast and Cervical Cancer Early Detection Program. Only the people sitting will be served. That's a pretty, to me, strong visual representation of what we need to get done here. We have a wonderful program. It's just that most of the people who are eligible for it, there's not enough funding to actually serve them. So, thanks. It's time to take action because all women deserve access to life-saving breast cancer screening and to get this program fully funded. Because the more money it receives from the federal government, the more lives will be saved every year. So before you leave this evening, I'm asking you to do three things. Lots of threes tonight. First, grab a pen and fill out your greeting card petition. The place inside. Okay? It's time to make your voice heard and urge your legislators to increase funding for this life-saving program. So please fill out the information and you can just leave the cards on the table. I will collect them when we're done and I will make sure that they get delivered to our legislators in Washington, D.C. Second, I'm asking you to take out your cell phone and text the number you see on your table's mirror centerpiece. That's text STRIDES, S-T-R-I-D-E-S, to 73585. This will ensure that the Cancer Action Network updates get to you as a STRIDES supporter. And third, have a CD at the advocacy table, which is cleverly disguised as a pool table, but it's one back there, in that corner next to the beverages. So come and get a beverage and come and see me. You can join ACS Can for $10, $20 if you want the pin. And the first three people who come back and join will also get this really cool t-shirt. The Making Strides Cancer Action Network t-shirt. Take action today. Help make sure all women have access to screening and treatment for breast cancer. Ask me how. Okay? So I have three of those for the first three people who come and join. And that's true whether you join at $10 or $20 or more. And I can answer any questions you have at that time. A lot of progress has been made in the fight against breast cancer since my diagnosis over 6 years ago, and I am hopeful for the future. But we cannot become complacent. That's one of the things I learned during my cancer journey. We must renew our hope every day. We have to be determined and keep hope alive. Having cancer changed my life in almost every way imaginable. I learned that cancer is not a gift, but each day is. We need to remember the past and plan for the future, but live in the present. Cancer touches all of us. Cancer takes a toll on all of us. Emotionally, physically, economically, we all pay a price for cancer, whether we are the patient, the family member or friend, the co-worker or employer, the healthcare provider or insurer, the taxpayer or community member. We need to fight back against cancer to raise awareness, to raise spirits, and to raise those ever necessary funds. ACS Can has a slogan that I'd like to borrow for this event and change just a little bit. The slogan goes like this: if one person can fight breast cancer, a community can rise up and defeat it. And that's why everyone needs to participate, so we can rise up and defeat breast cancer. So please, fill out your mirror postcards, leave them on the table, because with your help, we can change those odds that we saw when most of us were standing and only a few of us were sitting. Cancer is very personal, but it's also political. We're making progress, but we need to keep making strides against breast cancer. So please join me, raise your voices, and fight back. Thank you.